In Chapter 10, we're going to talk about measuring and measurement agreements, and the specific topic is going to be correlational, or also known as correlational techniques. With correlational techniques, there are several areas that are very specific to looking at correlations. And one thing that we're going to look at is, or to identify, is that we look at the relationships between variables or associations between variables. The ideal setting for using correlational techniques is something that really naturally happens. It's just a naturally occurring behavior, and it's something then that will be measured or studied. And you'll understand it a little bit more once we move forward into the PowerPoints. There's no dependent or independent variable, so one is not relying on the other, basically. It's basically when one thing happens, you see another thing happen with it. There will be no manipulation of variables like we have done in the past. They just happen. So once we move forward a little bit more, you'll be able to get a better understanding of how things just happen. And this is a really popular technique that's used in medicine and health sciences due to the fact that we're constantly studying what effect one procedure may have on another procedure, or what one medication may have to treat one particular ailment, how it may have a adverse or different reaction to something else. And just what comes to mind when I think about that is, I think I told you before, for many years I taught pharmacology, and the one medication that was used as an antidepressant, which is a selective serotonin reuptake inhibitor, was Wellbutrin, and that was for one of the older drugs used for depression. But the one thing that they noticed with Wellbutrin was that individuals that were smokers were cutting back on their smoking, or actually quitting their smoking. So they did a correlational study to see if that Wellbutrin was actually the reason for the decrease in smoking. And through the studies, they had determined that it was the reason why. And now Wellbutrin is actually one of the very popular medications. It's actually prescribed for tobacco cessation. Zyban is another name for it, but it's actually Wellbutrin. So you can see what one variable will do affects another variable, and that's kind of what we look at with correlational techniques. And the one thing I like to throw out there with correlation is that it is directional. So once we move on a little bit more into our slides, you'll see what I'm talking about with directions. And this is pretty much what we've already introduced. The bivariant relationship, basically bivariant meaning two, and what we're looking at, bivariant, two variables in a relationship, where one variable shows an association or a correlation to a second variable, which is already what we kind of discussed a little bit. Put in your mind right now that correlational techniques are not used to assess if there's a difference between variables. Basically, we're looking at whether or not there is an association. And I think we all use that word, correlate, things associating together. That's basically what we're looking at with two areas that we're studying. The bivariant correlation techniques assesses the strength and magnitude of the association or relationship between two variables. And then remember, we talked about the p-value, and the p-value is going to show if, once again, if the relationship is due to a sampling error or if it's just chance. Okay, because remember we talked that p-value 0.05, the strong association, and I'm sorry, greater than 0.05 strong association, less than 0.05 not so much of an association. And the bivariant relationship continued when you or the researcher is going to state their hypothesis. It's worded to indicate that the researcher is trying to look for an association between two variables. So the example that the book uses is a study by Mock and Lee from 2008 examined the relationship between anxiety and pain intensity in patients with low back who were newly admitted to an acute care hospital setting. So what they're looking at is the relationship between anxiety and pain, and we're going to compare that with the individual with low back pain and somebody that was newly admitted. So that, to me, if I'm looking at newly admitted, I'm going to say that that is, and they're saying acute care hospital. Obviously, that's an emergency room setting. So we're going to assume that's an acute situation where the individual comes in with low back pain, and we're going to see if there's a relationship between anxiety and pain intensity. And this is what I said early on. The hypotheses are usually going to be directional. So the example that the book looks at is we predict that high scores on medical outcomes scale social support will be associated with higher happiness scores. So they're looking at whether or not the scores on this particular medical outcomes social support scale, if the outcomes of that are higher, they're probably going to be associated with a higher happiness score. The individual is going to be happier. So basically what they're saying is, based on this, the social support system at the hospital would be associated with individuals that were higher or happier. So that's the directional relationship that you're usually going to see. The researcher will conduct the appropriate statistical test to determine if there's a meaningful relationship. Generally speaking, it's a parametric test that is called Pearson's product moment correlation, and it's generally used for correlational relationships. And remember, with parametric tests, we use those when our data is normally distributed. Normal distribution. We talked about normal distribution, I believe, back in chapter 4. If the data is skewed, it's recommended that you use a non-parametric equivalent to the Pearson's test, and usually the non-parametric test that is used would be Spearman's. So keep those two names in your head. The first one, of course, is Pearson's, and that's represented by a small letter R, and that's for normally distributed data. And if it's skewed, not distributed normally, we would use a non-parametric test called Spearman's. The bivariant relationship is very easily identified on a scatter plot, and a scatter plot has a horizontal axis that is represented by an X, and it has a vertical axis represented by Y. So looking at what would be ideal or perfect correlations, we could say for every 1 unit increase in X, okay, that would be the horizontal field, Y increases by a constant amount. Okay, so this means that all the dots are going to fall on a straight line, and our Pearson's, remember that Pearson's product moment correlation is represented by that small letter r, is equal to a positive 1. And a positive 1 meaning a perfect positive correlation. So if you go across and you look at the scatter plot on the left, for every time that we have a positive 1 movement horizontally, we see that it moves up vertically. Okay, so that's a positive correlation. Now, on the other hand, if you look at the scatter plot on the right-hand side, for every 1 unit increase in X, Y decreases by a constant amount. This means all the dots once again fall on a straight line, and our Pearson's test is equal to a -1, which is a perfect negative correlation. So you can follow those dots down the line on this scatter plot and look. If we're looking across at the bottom once again horizontally, and we're way up here at 50, okay, and we're going to move over one spot horizontally, you can see, drop your finger down or however you're doing it, and you can drop down and see that we drop down 1 equal increment vertically. Okay, and the same thing once we're down to 40, you can see how we're moving in a negative fashion with the correlation. So looking at imperfect correlations in a comparison with the last slide we looked at perfect correlations, you can kind of just look at these scatter plots and see that there is definitely a direction. Starting at on the y-axis at just about 20, you can see how our scores are they're spread out, but you can see it's a direction that moves from the axis where y and x meet. You can see that it moves in an upward towards the upper right hand corner of the scatter plot. So we know right off the bat that that is a positive movement, but they're just not perfect. So they're not on that perfect line like we saw with a perfect +1 or -1 result. So just looking at this, we're saying that people with low scores on social support tend to have low scores on happiness, and that's just following the plot from X and Y. You can kind of see that. You see it moves in a positive direction, but they're not a positive increment. And the same with the scatter plot on the right hand side. You can look at this and you can see once again we can follow all the way up to the upper left hand corner on the y-axis at about 50, and you can see how they divert or drop down into a negative fashion, just like we had seen in the other slide, but they're not perfect. They aren't perfect increments that they're sliding down on. And what this scatter plot is telling us is that people with low scores on social support tend to have high scores on fatigue. Okay, so you see where our fatigue actually starts at. Way up on, the first one is way up on 55. And then we have something called zero correlation, and if we look at this scatter plot, we can definitely not identify any sort of a correlation. There is no movement as far as being able to associate the X with social support in comparison to Y in intrusiveness. So there's apparently no trend. We're not seeing a positive or a negative trend. So we're going to assume that there's no correlation. And then this little diagram on the right-hand side, it just shows the strength of correlation coefficients. And if you look, we started at the very base at 0. And as we move up, you can see 0.1, 0.2. This is on the left-hand side. These are positives. And you can see the negative side on the right-hand side, how it moves up. And this is kind of what we're talking about. If you notice, to me, this is easy to kind of visualize then where our bivariant coefficient relationship is going to be, because if you look down, we have a positive 0.1 and a negative 0.1. And so remember, we talked about that equal increment or movement. And so you can see if we start having our dots on our scatter plot falling on positive 1, we can see how easily that's equivalent to a negative 1. And going up the scale to positive 0.2, 0.3, and how when we put our dots on our scatter plot, how they're going to either be a negative or a positive. And then we have something called partial correlation, and that's where the correlation between two variables are looking to control a third or more variables. It's also called partialing out or covarying. So that's, looking at two different variables and seeing if there is a association between a third or even a fourth. And then Spearman's row is, once again, what I spoke about a little earlier, is a non-parametric test. They often use this when the data is skewed. And remember, our non-parametric tests make no assumptions about normality. Okay, whereas our parametrics, they do. All things being equal, non-parametric tests are not as powerful as parametric tests. And another area that's important for you to have an understanding on is the book talks about test-retest reliability. And test-retest reliability is basically what it says. If we test something and then we retest it and then we retest it again and all the conditions are the same, the instruments are the same, then that test should be able to be used by anybody, and the results that you get should be what we consider reliable. Okay, they should be very stable, reliable results. So the bullet here says the variation in measurements taken by a single person or instrument on the same item under the same conditions. So everything has to be repeated. And if it's repeated in the same situation, then you should have, that it should be reliable. It should be a reliable test to use under the same conditions. The test-retest variability is practically used, for example, in medical monitoring of conditions. In these situations, there is often a predetermined critical difference, and for differences in monitored values that are smaller than this critical difference, the possibility of pre-test variability as a sole cause of the difference may be considered, in addition to, for example, changes in diseases or treatments. So all this says a lot, but all it's saying is that when we're talking about medical monitoring on any sort of tests that may be, or experiments that may be done, we have what we consider normal or within normal ranges, but they will come up with something that is a critical difference. So you can look at, say, hours till your medication. If you take your medication, you can say how long is that medication going to be used by the body, that we still have the effect of that medication that we want. So if we would look at a scale, we could see the medication starting in the system. It's not at the medicinal level that it should be, say maybe in 2 hours, but it starts to become effective at like 3, 4, and then maybe it peaks at 5, and then we start to drop back off again, coming back down the slope, and as the hours continue to increase, the amount of potency from that medication decreases. Okay, but there's a critical difference. There's a spot, say at 5 hours, that we say that medication is no longer, has not reached its peak. It's now dropping off of its peak as far as effectiveness goes. So that's that critical difference that we're looking for. It's going to show us the where the actual change or effectiveness or association that we're looking for. It's a critical difference. Okay, and talking a little bit more on test-retest reliability, this is kind of what I had already said. The test-retest reliability is desirable in measures of constructs that are not expected to change over time. For example, if you use a certain method to measure an adult's height and then do the same again 2 years later, you would expect a very high correlation between when you did it the first time and when you did it the second time 2 years later, because you wouldn't expect that individual's height to change. If the results are differed by a great deal, you would suspect that the measure was inaccurate. So something happened in the first or the second time that the measurement was taken that was inaccurate. So you wouldn't expect that if the test-retest was done correctly. The same is true for personality traits, such as an extrovert, which are believed to change only very slowly. In contrast, if you were trying to measure someone's mood, you would expect only moderate test-retest reliability, because people's moods are expected to change from day to day. Whether they're an extrovert or an introvert, that's not going to change from day to day. That's pretty constant with their personality. A very high test-retest reliability would be bad, because it would suggest that you weren't picking up on the changes. Okay, so if you had a very high test-retest reliability, remember we talked about that critical difference? So that's what they're kind of referring to here, is if you put that high, that little tiny bit, that little critical difference, if you put it at a high number, you're probably not going to pick up on when we actually changed over to notice that there were actual changes taking place.